So Kimberly spent over a decade cultivating a career in higher education. And then in 2019, while presenting at a conference, she was approached by a gentleman. And this gentleman was one of the co-founders of Elder Care Solutions. And he asked Kimberly if she would be a consultant with the business. So Kimberly was invited to join the work of Elder Care Solutions at the end of 2019 as the CEO, but she really needed time to think about it. And while thinking, she was thrust into a care situation. And as most of us know, when we're thrust into a care situation, it's not planned. So this experience really helped her to solidify her decision to accept the CEO position with Elder Care Solution. I'm going to share with you what she is going to be speaking on today, and that is the cost of aging and caring. And of course, as we all know, perhaps this is the toughest challenge in need of the most collaborative solutions.
Okay, so let's talk about the cost of aging and caring. And this is filling up everyone's screen, right? Like it looks like a presentation. Okay, good. Just wanted to make sure.
Yes.
So what I wanted to focus on, please let me introduce you to Esther. So Esther is the piggy bank who is the mascot of Elder Care Solutions, and she continuously helps me talk about and give graphics to the principles and the theories or the concepts I'm talking about. So she's extremely helpful, and you'll see her throughout the presentation. So Esther and I together are going to let's just look and identify some of the reasons why long-term care is so incredibly expensive for families right now and why it's so tough for them to pay for. Also, some of the realities surrounding the financial impact that that overwhelming cost is having on families right now. And then I really just want to take some time at the end to brainstorm together some possible collaborations that people in the group might have ideas for just making this challenge better. So my mission with Elder Care Solutions is I always say my North Star is the finances. So I am guiding families so that their aging and their caring experiences are as financially positive as possible. I am not a financial planner. I am not someone who does the financial work. I am a guide. I'm using all my expertise in interprofessional and interdisciplinaryism to connect the dots for families. So I have mapped out the spaces to say there are different professionals and organizations and resources and even tech tools that exist out there that can help you have a more financially positive aging and caring experience. And I'm going to start connecting those for you so you can build your puzzle, however that puzzle is going to look for you, for that family. My big mission is I don't want aging and caring to financially break a family. And the realism is it is financially breaking families right now. So I think a really great way to kind of give a picture of what the problem is, let's just use a case and she'll kind of carry us. So Beth, this is Beth, not Esther, because Esther's pink. This is Beth. Beth is an 82-year-old female piggy bank. She's widowed. She broke her hip 4 months ago. Now, she had to have surgery, and that was covered by her Medicare plan. And she needed rehab, and 90 days right after her surgery was covered. But then Beth is home now, and she hasn't had rehab for about 15 days, right? And she's by herself. She's widowed. She lives independently. To stand up and cook her meals and make sure she's having healthy food to help her heal from everything she's been to is extremely hard to do. Her balance is really bad because she had hip surgery. It hurts her to do that. To do laundry or to bathe herself and dress herself are really risky tasks for her, and they put her at fall risk. And she doesn't drive right now, but she does have follow-up appointments that she needs to get to. She needs to go pick up her medicine. So just start brainstorming in your head where you see the gaps, right? There's some gaps here in Beth's stories, and Beth's story is not unique. This is a real situation that a lot of families are facing. Again, not educating you, just providing a big, well, I guess, education is a big part of Learn, but I know there's some people here who are experts here. But let's start with Medicare, because Beth has Medicare, and a lot of families have their loved ones that are 65 plus, and they have like this sigh of relief, like, whew, mom and dad have Medicare, only to follow that with gasps of surprise when they realize how little of what their parents need is actually covered by that plan. And that's not necessarily the plan's fault. It's just the type of care that our loved ones need today is different than what Medicare was designed to cover. And that's a policy and legislative issue. So Medicare, she has it. There's Part A and Part B. Traditionally, those are your hospital and your medical insurance. So her inpatient care, the limited time with skilled nursing or therapy, and even hospice care are going to be covered under that. And then Part B, the medical insurance, her physician services, services with other healthcare providers like a PA, any outpatient care that she needed, durable medical equipment is often covered there, and some preventable services are covered there. And then if she needed anything extra, she'd have to get a private plan, like a supplemental or an advantage plan, to cover some of the other things. The big picture is Medicare is there for that medical care, and then short-term support when it comes to any help that's needed after that medical care was done. So yes, it covered her surgery. And then they're like, okay, you need rehab. That makes sense. You need help with your hip, but we're going to give you X amount of days. And that's exactly what they do. They're going to limit the time frame. If Beth, or who, let's say she has an adult child, and we'll give her a female description because that's the typical picture. So her daughter, who's an adult, is like, Mom, you need more care, and your Medicare plan is saying they won't cover it. Probably someone in their network is going to bring up Medicaid then. Oh, well, you need to get on Medicaid is what they'll start to say. They'll think, okay, that makes sense. And then they start investigating it. And there's reasons why this also doesn't work for a lot of families. So this is our health insurance. It's the next governmental support, but it's for financial need. So families that are in financial need. The good thing about Medicaid is its care coverage is a lot broader than Medicare. So there are, again, Medicaid is very state specific, just like Ellen brought up earlier. But there are mandatory things that Medicaid has to cover. And then there's optional things that's where every state gets to decide, like, what are those extra things that we're going to provide? The mandatory things are like the in and outpatient hospital services, the physician services, lab and x-ray / diagnostic services, and home health, surprisingly, with some other things around that. Case management, prescription drug coverage, therapies like physical and occupational therapy are actually, they fall under the optional category. So some states cover it, some states don't. What is phenomenal when it comes to long-term care is Medicaid does have their home and community-based services, which then kind of brings in, like, when you need home health, when you need home care, there's some extra financial support there. And that's what gets people really excited, because that's actually what they're looking for. But for most middle-class families, which is our largest socioeconomic status in the United States, their asset limit is too big to hit Medicaid. And Medicaid, again, every state is specific, but you're generally looking $2,000 to $2,500 of assets. And like Beth has a pension plan that was left from her husband, and she has a small annuity that's paying her some money, so she doesn't qualify for Medicaid. The third of the three big governmental supports is veteran benefits. Now, the big thing here is not everyone qualifies for this, because you either have to be a veteran or the spouse, a living spouse of. But if you do qualify, this really is the most comprehensive financial support that you can find for long-term care. When it comes to long-term care needs, and we're going to start defining that in just a minute, your aid and attendance benefit is really like the big go-to, and then there are some extra supports around that that you can dip into, but that's the biggest one. Aside from you must qualify by being a veteran or a surviving spouse, this is a hugely bureaucratic system. It's really hard to navigate. The application's kind of intense. And it's also, even though it says it's a pension plan, it's actually a reimbursement benefit. So you have to incur care costs first and then get reimbursed for them, not here's a check for X $1,000, go spend it on care. And that can be a little difficult for families to navigate as well. But they cover a lot. So adult daycare services, home care, home health. You even can get money to make sure that the home environment is accessible and safe for the people living there. There's caregiver support to support the people who are caring for the veteran. So there's a lot there, but the navigation of the system is difficult. So looking at Beth and knowing if she goes and asks most people, what can I do? They're going to bring up these three things, right? Most typically. Medicare is something she has, and it was there. It covered her surgery, her limited rehab, and let's say she has a really great supplemental plan or advantage plan, and a lot of her pain meds have been covered there too, okay? But because she has some assets, some saved money, a legacy item from her husband, she is not qualified to receive Medicaid. And this is the majority of people that I talk to. Like there's something in place, some smart move that they did when they were younger that is now preventing them from accessing Medicaid, which could help them if they only didn't have that money, right? How is she going to get help making sure that she has access to healthy food, she can cook, she can get around to the places she needs to get to, she can socialize well, her laundry, her bathing, her dressing is going to be safe and okay for her, her housekeeping? That is activities of daily living, and that is long-term care, not medical care. And that is this huge gaping hole that we have in our current infrastructure where there's no support for families financially. So if she needs anything right now, and we all know those 90 days or 100 days of physical or occupational therapy that she received, her need for that didn't end when that clock ran out on Medicare coverage. She probably still needs some more rehab, but she's going to have to pay for it now privately. If she wants someone to come in and help her make sure her house is clean and she's eating okay and helping her get bathed and dressed, she's going to have to pay for that. If she needs help getting around, she's going to have to pay for that. Or, and this is what most families do, someone from the family steps in and starts doing those things because they don't have the funds to pay for it. And this is kind of this perfect storm that's brewing out there with our families. So one aspect is that there's a huge longevity issue. The reality is individuals who are 65 or older today are living 19 years longer than their counterparts in the generation before them. So that means in one generation, we gained almost 2 decades of life. As long as there's not an acute problem that hits them, people living to 100 years old is so incredibly realistic right now. And that's where families are. They have an 82-year-old mother who she can't be completely independent. She needs some help, but she's probably going to need help for 20 more years. And that's not what aging used to look like. It used to be that our loved ones would start needing help and then their lifespan just wasn't that long, but it is now. And one of the reasons why longevity is upon us as readily as it is that our aging loved ones are healthier. So one thing about baby boomers, the messaging to us over and over has been they're huge. It's a gigantic generation, and that's true. But something else that's very special about them is that they are the first generation that have gone through modern medicine for their entire lifespan. The very first generation to have modern medicine since the time that they were born. And that modern medicine has changed their aging game. So now we have very long, late chapters of life where that was not the reality in just the generation before them. What are chronic conditions today? And the definitions of chronic conditions today are diabetes, heart disease, cancer. These chronic conditions were yesterday's death sentences, but today they're not. Today, they are well-managed chronic conditions. So they need access to healthcare and they need help, but it's not the kind of healthcare that they used to need. So the generation before the baby boomers needed medical care a lot more readily. They had acute conditions. They needed skilled nursing care. And Medicare was set up for that. So it was kicking in and helping them really well. But the baby boomers need long-term care. They need help with activities of daily living. They don't access medical care quite as readily because they're much healthier. And Medicare was not set up for that. And so that's where we're seeing a lot of gaping holes when it comes to the care that is needed, and there's nothing there to support the financial costs of it. So I work with families. I am located in Roanoke, Virginia, but I help families all over the US. And I help them in two ways. I guide them with consultation by connecting the dots for them to say, okay, you download your situation for me, and I'm going to tell you, I know about some stuff that's out there, and I'm going to help you tag up to that. And I also provide a lot of education on this is financially crippling to families. You're not necessarily doing anything wrong. You're just in a system that's setting you up to cripple you financially. So let's learn about it so we can navigate it better, right? This is both data that has been collected nationally, and also I can tell you from my personal experience, my clients fall within this perfectly. So I actually see this. 78% of families are incurring out-of-pocket costs due to care needs. So when care comes up for their loved one, they are having to pay for it privately. There's nothing there to cover it. Yes, absolutely. So about 80% of people are just spending money. And where does it come from? Typically, they start with their aging loved ones' legacy items like their retirement accounts, their long-term savings, their pension plans, and then they spend it down. And then there's nothing to pass on, but they've gotten through it. And now they start dipping into their loved ones' money or navigating whether Medicaid is eligible for them or not. These costs are pretty high. The annual average is $7,242. That's pretty low from what I see. I typically have families that spend around $1,000 a week to get all the care that they really need. If a family caregiver, so that person who has stepped in to say hey, mom or dad, I'm here, I'm going to come in, I'm going to help you out as much as possible so we don't have to spend money on this. If they're working, they're typically spending about 40% of their income to cover some of the care needs. Families, around 20% are just spending down their savings and they're losing legacy items. This is typical for the families that I help. And then we all hold a solution. I think everyone on this call is a piece of this puzzle, but families have no idea that you're out there. So they don't know where to look. They don't know who they need to talk to. There's no direct cognitive idea for them to say like, oh, we can't pay for this. We need to go talk to no one knows. They can't fill in that blank. And so we really have to figure out how to get that messaging to them. So the big thing that I did when I joined Elder Care Solutions is I just started mapping out this space. And so I figured out who had answers. I made friends with them. I said, tell me all the answers you sit on. I'm going to individualize them. And I built a giant master list of like, if someone said, I need to pay for long-term care, here's the list of solutions. Like this big giant list, and it grows and it changes because new organizations pop up or insurance products change, new policies get put in place, new tax breaks come up, other tax breaks go away, so things change. But if I can have this big list, then I can start matching families to it. And I actually built technology around that. So families can answer a very simple questionnaire, all yes, no. I don't need numbers and account numbers. I just need realities. Is this a part of your reality? Yes or no? And then I can match up to them a strategy and say, here's a strategy out there that actually fits your situation. Let's learn about it and explore it and see if you want to go for it. And if not, there's others, because there's lots of strategies. And I really push this mission of like families are just looking for this magic one answer. They're like, just what is the answer? And they think they just haven't found the person who has it. And I always stress to them, there's no beautiful magic answer. You haven't not found the person who knows it. There's just lots of answers out there, and we're not really talking to each other very well. So I'm just going to help you find all of them, and let's start putting them together. All right. So elder law attorneys and also attorneys that aren't specifically elder law have some fantastic answers, like Ellen on the call. Fantastic answers. They can help with estate planning, which some families have not even done. They didn't think about doing it. They don't have their stuff in order. Getting their powers of attorney in place. Medicaid planning, and I love the planning part. Like, let's not be reactionary. Crisis is definitely where families are today. But if we can catch them and say like, hey, this is going to be something you're going to tap into eventually. Let's start planning smartly and make smart financial decisions now, so that is something that's going to be successful when you get there, because you can definitely make some financial decisions that are going to set you up to fail when you get there if you're not thinking very carefully. And then some attorneys in this category also will specialize and help with the veteran benefits assistance, which is phenomenal because it's very hard to navigate. Financial planners have amazing answers as well. They have really smart answers on how to make smart financial decisions right now, which assets to tap into, which ones to protect, which ones to tap into in different ways so that it lasts you as long as possible. They're also fantastic connectors. So they have beautiful answers. CPAs, no, they kind of keep their finger on the pulse of all the current tax breaks and what tax decisions you can be making, especially if you are starting to leverage savings and retirement assets. You want to be smart about the way you do it. Like taking out lump sums is not the best situation. So they can really help with a lot of those answers. Insurance products like life insurance and long-term care insurance have come a long way. Most of the families that I help now, their aging loved ones don't have long-term care insurance. And there's a good reason for that. With the time when they could have bought it, those products were not fantastic. And they were really not a good investment. Today, they're a much better investment. But we're going to be looking at like when Gen X and millennials age, that they'll start having these products in place. They also have beautiful, creative hybrid products today that are really smart and really great. But unless you connect with those professionals who can tell you about them, you don't know. Now, life insurance families tend to have, and there also are some creative and innovative ways to tap into those when you need to pay for long-term care, but you would never know if someone didn't tell you that those exist. Housing wealth experts, there were a couple mortgage brokers here too. Also really great techniques there. How to utilize the equity within a house, either be it a reverse mortgage or a HELOC or some other strategy. Those are things people need to know about and then decide if they are good situations for them or not. Our organizations like area agencies on aging and nonprofit organizations also have strategies there. So our area agencies on aging are funded by our states. They have programs in place to help families. Most families have no idea that they exist. So just guiding them there to say, like, let's go look at their programs and see what they have. I've seen such a wide variety. My local area agency on aging has great programs, but only for people who are already on Medicaid. That's not incredibly helpful. But an area agency on aging 1 hour away offers 10 hours of home care completely free. The only qualifier is that you're at least 65 years old. That's it. So you never know until you ask what they might have. And also nonprofit organizations tend to have like grants that they can give to family to use towards care, especially if it's tied to specific diagnoses like dementia or Parkinson's. Those are popping up more. They will have support groups for families, and then just a plethora of other varieties of financial supports. Employers, caregivers and their families need to know that they can talk to their employers and leverage really smartly their benefits and their policies. So let's take a look at FMLA. Does it cover the situation you're going through, and how can we smartly utilize that to save you some money? Let's look at the benefits. Is there free financial planning consultations that come with your employment that you can leverage to make sure you're making smart? There's stuff there, and they just don't know to go ask, or they could be a little scared to ask. I love working with, and I also heard that there were people on the line that are Medicare brokers, because when it's open enrollment, which kind of is happening all the time now, families just have no idea how to pick these plans. It's so overwhelming for them. Just like somebody said, they're clicking the buttons on their screen and they're like, I think I did it. But then they end up with a plan that doesn't actually fit what their care needs, right? And so they could either be spending too much on premiums that aren't covering the care, or they don't have enough coverage and they really could up it just a little bit more. And so I work with Medicare brokers a lot just to say, can you just sit down with this family and look at their plan and see if they actually do have a good fit? And it is so common for families to save $1,000 to $2,000 a year just by getting a plan that fits them better. That's it. And then technology. There's lots of tech like DARA's tech that's popping up out there that can just save time, which a lot of times for families is money, have cost-saving resources that just can really help out in the situation. And so connecting them to those technology solutions. And I made a PDF out of this so it could be easily shared with you guys. You can scan my QR code or just visit me. This is going to take a lot of answers. And any one family will probably need about 5 solutions at the very least, just to kind of fit in and help with their situation. And so people with collaborative spirits are going to make that a lot easier for you as you're helping families. Yeah.
Kimberly mentioned it, but she does have that software product is available for your clients it's very affordable to do kind of a first step assessment of what might be available to them. And if you're interested in learning more about that, how to access it, please reach out to Kimberly. I'm sure she would be more than happy to show you.
I always have families framing in oh, I'm scared to start that conversation. It feels uncomfortable. I have a lot of guilt about it. And I try to say, let's reframe that to if you sat down in front of your mom or dad and said, I want to love and respect you the best I can. How can I do that? Please tell me what you want to happen. It totally changes the conversation, right? It's much more of I want to make sure I'm respecting you and doing what you want. And so please tell me while you can what that is. And that's how I can show you love, and then the conversation's a little easier to approach, but it's still difficult, people, they don't really love planning for this.
As professional education chair, I also want to say thank you to Kimberly and Esther. We have to thank Esther as well for sharing your time and your passion